each of the panel and the discussions we had in the morning was about what we all need to accomplish, be it in the area of diversity, be it in the area of providing better care, be in the area of building infrastructure for providing good care. But one thing always resonates, that any company, any organization, any department cannot do this alone. It always has to be a collaborative spirit of partnership, so that whatever goals we have set for ourselves, whether we want to see as far out as 2047, or we want to see as close as the year that we are in, the power of collaboration, the spirit of partnership would always help us and get us closer to the goals that we all have. As already introduced, actually today it is a very humble privilege of me. I have three very senior leaders on the dais with me: Dr. G.V. Rao from AIG, Dr. Pishnu Panigrahi from Fortis, and Dr. Madhu from the Apollo Group of Hospitals. All three are stalwarts in their field, and now I have the task of making sure that I can bring their insights to you. So you can wish me all the best. I'll try my best so that I can really bring their learnings of the vast experience they have to all of you. Thank you so much, sirs. We are really privileged to have the three of you. Just to set the ball rolling, right? We just talked about partnerships. So maybe I'll start with you, Dr. Rao. Today, when we look at partnerships, which are the main areas where do you feel is the need of partnerships arise? If we have a goal of providing good quality healthcare, we have goal of building capacity and competence in the healthcare system, we have number of goals to leverage technology into improving patient outcomes. Which are the areas for you as a professional and for AIG as a group do you think makes most merit for partnerships to be formed?
Thank you. Thank you so much for having us here. I'm a clinician basically. Even today I practice 90% of my work is clinical work and 10% is administrative. Started as a single team, actually not much exposure to collaboration. You understand, we are working as a team, but over the period of time we started working with teams right now. And we understand that the collaboration is the most important thing here. It is not just collaborating with the teams within the hospital, but I think it's collaborating with the government, collaborating with the industry, collaborating with the patient, most important. Unless and until we have a good collaboration between all these things, we will not be able to deliver the equitable and affordable health care to people as of today. So I feel the industry, the government, the patient, all are important collaborators as of today with team. We have to interact to make sure that we deliver this proper care to the patient.
No, thank you, Dr. Rao. You talked about collaboration and the collaborative spirit. Dr. Vishnu, would you like to add to that? Because collaboration is seen differently. Sometimes we see these are different goals getting aligned for a synergistic nature. Sometimes it's seen as risk sharing towards a common goal. How, in your mind, again as a professional and as an industry veteran, you see the spirit of partnerships?
First of all, thank you Economic Times for inviting us here. See, healthcare is about, everything is about partnership. And on a personal level, I'm an anesthesiologist in critical care, and there's no better way that the partnership, you walk the talk as far as partnership is concerned. Because you have to handle...
Dr. Vishnu, if you could just hold the mic closer to you, and if you can adjust the volume, please.
Stakeholders in the hospital.
Yeah.
So when you come out of that, so if you have that mindset, that is how you have to grow, number one. Number two, if you look at the healthcare scene, it is not only about running the hospital. There's an ecosystem outside also that we need to factor in, whether it is our the way we talk with communicate with the community, with our vendors who supply our equipments, with the government authorities. And one important thing I'd like to say is that I think so healthcare has to have a lot of focus on interact with the public health part, because if you look at in the last couple of months, Gurugram is a stunning example. We make multiplexes, complexes, flats of 100 crores are being sold, but the civil infrastructure is not being done properly, planned properly. that has a collateral damage on healthcare. So what I'm coming to is that, so it is something that while town planning happens, I think the public health people should be co-opted to this. Because when you look at now, at the time of independence, most of our deaths were because of communicable diseases. Now it is just the reverse, non-communicable. But in the morning session, they were showing about dengue, which is a scourge across the globe, and India suffers, and most of the major metros. And it is because of this. So this is where the partnership has to come in. And the other part, I think, so it's you had mentioned there about other partnership. In the morning session, there was talk about that this public-private partnership is just talk the talk. But it is also walk the talk if you do it properly, honestly.
Yeah.
So where both parties benefit, there's and I'll give a small example, and because it's good to say, although one swallow doesn't make a summer. When the COVID pandemic hit, I was for some time in Bhubaneswar, and the Orissa government realized that it's the private sector who can scale up quickly. Government sector doesn't have the bandwidth to sort of take it up. They invited the private sector to step up and come forward. It was a public-private partnership. 1,050 beds were put up across the state, 500 in Bhubaneswar and 200, 150 in 3 tribal district headquarters. It was done within 15 days. It was put up with critical care beds, OTs, everything, piped oxygen, pipeline. So partnership if it's in a true form, in the honest form, and there was a talk about Ayushman Bharat payments not coming. There within 30 days, the bills were submitted, 30 days the money is to come. So it has to be a win-win for both. Yeah. So sometimes a partnership is all about engaging each other. And the other one, since the folks are here from Punjab also, the Punjab government, earlier stint in Max, the Batinda and Mohali, it's a public-private partnership. Yeah. The government land has been given, the hospital has been set up, and the public also gets benefit there. So I think so there's a lot of way to take this partnership forward. I think so it's actually the intent, the honesty has to be there.
No, thank you, Dr. Panigrahi. But I think the point that Dr. Panigrahi made too, if I could leave for the audience, one, I think I really appreciate the point as you said, the intent of the partnership is the most important thing. If the intent then is backed by passion, partnerships do succeed and have a lot of place in our healthcare system. I have had examples in my career as well, setting up 60 CT machines in a state of Assam, where the reports could be read centrally anywhere in the country. That just kind of brings the support to trauma patients who otherwise might not even get a report or a diagnosis timely. The second thing also, I think it was interesting, talking about the infrastructure in Gurgaon, as you said. And how many of the people in the audience see Instagram? And how many of you see Instagram reels of Gurgaon flooded? Some with AI enhanced reels and some actual. We always talk about ecosystem within the healthcare environment. But let us say, even if they take the example of a golden hour, where you need to reach a hospital within 1 hour, you need infrastructure outside of healthcare as well. It's extremely important, and that's a part sometimes we miss out on. At times we talk about drones to be utilized or green lanes to be utilized for organ transplant. Sometimes we even miss out on the basic point of how do you get from your home to the hospital within 1 hour, even though you may be only a few kilometers away. Coming to you, Dr. Madhu, I think we're just talking about, partnership. Any point that you would like to add in terms of what could make partnership succeed, in addition to what Dr. Rao talked about, the intent, Dr. Panigrahi talked about building an ecosystem, measuring it. You also talked about sometimes basic operational tasks come into, or asks come in the way. If the payments are not made in time, the partnership could crumble, right?
Yeah. No, thank you, Mandeep. So first of all, I want to thank you. I want to thank the ETHealthworld for having me on this esteemed panel. Can you hear me? No, I just wanted to thank ET. It's an esteemed panel. It's a pleasure to join you. I'm a pulmonologist, intensivist, and an administrator, so I'll give you my viewpoint on that. Just to add to what Dr. Panigrahi said, both of you talked about public-private partnerships. Let me talk about industry provider partnerships, right? When I think about partnerships and where do we build value, I think it's about transforming the business, right? It's business transformation. And how do you transform the business? To me, at least, there are 4 pillars, and maybe I can give you some examples. I think the pillars are, and where we have done business transformations around using the data, optimizing our resources. It is about research and education, and lastly, it's innovation. So, Mandeep, we have used data in very interesting ways. Looking at our cath labs, a tremendous amount of data that is generated, figuring out how can we better use our cath labs. We've partnered with our industry partners in imaging, whether it's Siemens or GE, to look at the utilization of CT scans and MRIs to say, how can we better utilize our MRI and CT scans? What does scheduling look like? So I think there are various examples of using data and optimizing our resources. I think research and education is incredibly important. I would take the example of intuitive. Robotic surgery has a very steep learning curve. And without industry partnership, without things like the intuitive research, the intuitive fellowships, we could not train the number of robotic surgeons. And last is innovation. With a major vendor, we took all of our ultrasounds, looked at signs of liver fibrosis, which is usually not detected on a liver ultrasound, used AI, and now that's an innovation that is licensed and brought to market. So Mandeep, to your question, how do I measure success? To me, success is about scale. It's very, very easy to do proof of concepts. It's very easy to do pilot. But if you really want to be successful, you have to scale. And whenever a technology and an industry partnership hits scale, I know that we got everything right. We got the pricing right. We got the clinical benefit right. We got the marketing right. So to me, it's all about scale.
Sure. No, thank you, Dr. Madhu. And I think the point you talked about data, I'm sure most of you would have been there in the plenary lecture in the morning as well, when Dr. Sangeeta did mention about, you can't start to manage or improve something that you don't even measure. That's one basic start point of data. Secondly, also there is so much of quantum of data. When even there was a talk about, on translational research, it was about the good quality data that India is producing or can produce, but how do we manage that? But interestingly, Dr. Madhu, you talked about 2 very strong partnerships or companies. They're my previous employers. I wish you would have talked about my current one as well, but I'll take it. No, just kidding.
No, but that's a very important, I mean, you and I have, I think, new technology like the renal denervation.
Yeah.
I think it's a good example of scaling up a technology
Yes.
and building a very large program, because it's not about a procedure, it's about managing hypertension. It's about a comprehensive hypertension program. So I didn't intend to leave it out.
I was just saying that in jest, Dr. Madhu, but I think are great examples of partnerships. And the companies that also Dr. Madhu talked about are at a different stage of their life cycle, right? It still makes sense for them to innovate and have partnerships, which basically display strong common intent. Apollo is also there, as a massive organization. Neither would Apollo kind of achieve everything on its own, nor would the 2 big companies, that were mentioned about. That's the power of collaboration. Dr. Panigrahi, we talked about the success of partnerships, right? And Dr. Madhu was talking about the pillars, and then, how he would measure a success of partnerships, especially the ones which kind of, become scalable. Where do you feel partnerships generally fail?
The intent, I'm saying. That
We'll go back to the intent?
Yeah, because if you don't honor the intent that was put on the table to take it forward, so that is when things fall apart. I think so, like in the morning we were talking about that Dr. Yani set the ball rolling, that we have only 1.5 hospital beds per 1,000.
Yeah.
We should be at 3. And the sad part is that that's more than 3 in India. India means, I mean, Delhi, Mumbai, Bangalore, but not in Bharat, not in the tier 2, tier 3 cities and in the rest of the country.
I think we are very right. Intention is the most important thing. If the intention is economics, I think then it is bound to fail. If the intention is patient care, I think is bound to give good.
So that is why what I'm coming from the intent part is that partnership part. Now, if you have to take a healthcare forward to look at Viksit Bharat, to have a healthy nation, because without being healthy, you can't be Viksit. Yeah. So I think so. This is where the partnership has to come in. That because the health sector, as was told in the morning also, when we know about it, nearly 80% of the tertiary care, quaternary care comes from the private sector. So, honest partnership with the government to take this forward, then we can go into Bharat.
Yeah.
Let us not confine ourselves to India.
So, thank you, Dr. Panigrahi. Dr. Rao, you were also mentioning about the intent, right? And I think the trailblazer that AIG has been in its field, you also have had some very strong partnerships, and you're at the cutting edge of technology or adoption of technology. Would you mind sharing with the group here in terms of what do you do when you're trying to identify a partner? How do you really kind of look at the need and the partner who can fulfill that? And if you also don't mind sharing some examples of success.
Absolutely right. I think it is very clear from the healthcare perspective, there are two types of patient population that we're dealing with actually. One is an organic disease, second is a functional disease or a preventive disease. Now, most of the current day clinical practice or the aura of the hospital or the aura of the clinician is basically based on organic disease, technology, and the outcomes. This is what everybody is talking about right now. But there is a huge set of population whom we are not talking and who are responsible for the functioning of the country, who are deprived basically because of functional or any preventive thing. Technology is making big dents into clinical practice. Thanks to Medtronic actually, who lends us support. Actually, technology is coming in so fast, and the pace at which it is translating basically because of your efforts, training people, getting translated. Kudos to the effort that you're taking, and it is translating absolutely fantastic. So, but what I personally believe, actually maybe too radically thinking at what we practice at AIG Hospital is try to see if we can do something on get similar type of technology on preventive and functional diseases so that we can help a huge sector of people. Prevention could be nutritional. We have a very good nutritional department, functional department, you understand? And the new emerging concepts wherein technology is coming in a big way. It is unseen, but it is going to be a mind-blowing thing in future. You talk about a microbiome clinic tomorrow, is going to be the end thing of what is going to be practiced. So technology as in today, I mean, it's purely organic disease technology that is getting translated. But we have partnering with other people, you understand, who are also working on the preventive nutritional aspects of the thing, which is going to make a big dent, especially in India, because that constitutes a big chunk of patient population.
Yeah. So thank you, Dr. Rao. And I think on the point of preventive, I think during the day today, we've already heard that thing 2 or 3 times, right? That if we are really to manage the healthcare in the country, preventive healthcare has to be a key part of that. In fact, I'm reminded of one of my colleagues' words at some point in time in the past. I think that time I was working with GE, and he said, we are all sick care companies. We are not healthcare companies. We are caring for people when they are sick. But the real merit is actually caring for people when they're healthy. So I think that really has to build into our healthcare continuum. That is one part of the continuum where we are weak today.
Actually, absolutely. I'll give you an example. Actually, we started a thing called Janani Mitra, which is we tagged on to the rural pregnant population of both Telangana and Andhra Pradesh. We are able to track their diet, we are able to track their investigations. Surprisingly, within about 8 months after we started this entire program, the number of deaths, infant mortality or the maternal mortality is dramatically reduced in those 15-20 townships that we adapted. So basically these are the things that we're looking at in future as to how to use technology to prevent diseases actually, both from the nutritional point and the functional point of view.
No, thank you, Dr. Rao. Dr. Madhu, just a thought from your side. As we look at bridging this continuum of diagnosis to therapy, we talk about a lot of data. You also mentioned about data. We talked about leveraging artificial intelligence. Where do you see where companies could work together there, right from helping algorithms to diagnosis or using really patient-centric data to devise new products? Where do you see the spirit of medtech company partnerships there?
Yeah, so I think really when you start looking at these emerging fields of artificial intelligence and using patient data to create new knowledge and new value, I think this is where really there needs to be strong industry partnership with providers. I'll give you a couple of examples, and this time, Mandeep, both are Medtronic examples, because my previous organization was Cleveland Clinic, with a long history of both cardiac innovation and brain stimulation innovation. And while we have the patients and we have the pathology, what we do not have are the hundreds of PhD level engineers who can turn this data into innovation. And if you look at the evolution of what was a big box that you had to carry with you as a pacemaker to now a leadless pacemaker, right, that will last for 10, 15 years. I think that pace of innovation would not have happened if it were not for a very, very close collaboration between electrophysiologists and industry. And I think DBS is another example. So I think as we get into AI and very, very complex analysis that require multiple data points and aggregation of data from across the globe, it becomes even more important that there is an industry partnership. And I think we also need relevant data for the Indian context, which I think today is missing. And I think this is clearly an area where companies can collaborate with us to generate solutions that are much more relevant to the Indian context.
No, thank you, Dr. Madhu. I think the point being, as you rightly said, any new advancement, any solution or a new technology development, at the heart of it has been the patient need. And then how it also becomes scalable and how we can bring it to really determine outcomes. Dr. Panigrahi, a question for you, a bit more into the future. Today morning, since morning, we have heard a lot about 2047, right? Sometimes my feeling around 2047 is a bit different, because that's so far away. The world may have changed 10 times by the time we arrive at 2047. But if we just look at the immediate outer years, what in your viewpoint should be the pillars of how medtech companies and healthcare providers should see the future, so that the seeds of the 2047 we can sow now? Many of us might not be in active roles at that time, but we could look back and see in terms of what we all started as a journey is changing India towards the way that we want to transform it. So how do you see in the immediate outer years we sowing some seeds of such partnerships?
The building blocks obviously are data, patient data. So I think the electronic health records that many organizations have had or are in the place of putting in place, that is a high priority. Because as Dr. Directly mentioned, and in the morning also we heard about it, India has huge data, but it's not being properly. We keep quoting in Western data, and based on that we look at our therapies, our pathways and all that. So I think this is sometimes the data of each and every patient needs to be kept, because so far most of our hospitals we have it in the file. But as we are moving, this will be the first gold standard that has to be put in place. Data portability has to come, and this is again a partnership. What I'm saying is that all the major healthcare providers, whether it's the public or private, the patient data while maintaining privacy needs to be, because then you can know what is the disease prevalence, if with this treatment, how this patient behaved. So you can customize your treatment care going forward. So this is something that has to happen, and I'm confident this is going to happen.
Sure.
Because to fact the government also, the Ayushman Bharat digital mission, that is the long-term goal. Still there's a lot of teething problems there. But once that comes, I think irrespective of public sector, private sector, a standard common denominator of patient data will be there. And that will give us a sense check of each disease segment, how they have behaved, how they behave to surgery, to medical management, and you can customize your care. Yeah. So I think that is a very important thing going forward.
I think that's very interesting. That theme is continuously coming, that data is the new gold or data is the new oil. I think we're becoming quite a financial savvy country.
Sorry, the other part which I like to again re-stress is on the outcomes.
Yes.
All your outcomes has to be measured, because if you measure your outcomes, you know whether the right care was given, and all clinicians are smart. The moment they see that something is not right, they will make course corrections.
Yeah.
I'll give just an example. I'll give. We capture clinical outcomes. We have been publishing it from 2016. Put it on our website also. In a hospital, like my friend Ethan is not here, for a CBG, the left internal mammary artery to the LED is the gold standard. And we capture it. What percentage? In a certain hospital, in a good hospital, it was around 57-60%, which is way below the international standards. And we kept on sharing with the hospital. We didn't pull them up or anything. Believe it. They saw through it, and it is there where it should be at international parts. What I'm saying is that data, if captured properly, looked at, it gives you insight to introspect and improves. So who benefits? The patient.
Yeah. No, thank you so much, Dr. Panigre. As the two things I said, data is gold, and not only in terms of input, also the outcomes. The time is up, but a quick one to you, Dr. Rao. Again, how do you envision the future of the partnerships? And then I'll come to you, Dr. Madhu.
See, the same question if you would ask me about 10 years back, a decade back, people would have relied on Babas and crystal ball. But I think the new thing is all about AI. I think I strongly rely on AI predicting what is going to happen in the future. This is the in thing, and the whole thing, as you rightly said, is data dependent actually. And the same thing actually, we are able to see something really translating in my own hospital, wherein we are able to predict sepsis in patient, number of code blues have decreased, we are able to predict NASH, we have got the FibroScan out of clinical use. We started writing some algorithms or technical procedures, decrease the morbidity, you understand? So many things have happened incorporating AI. It is not that it is totally replacing the natural intelligence, but you are adding on to what you have in clinical practice. So if I have to predict what is going to happen, I'm totally going to rely on AI to predict, to make sure that not only predict what disease, predict how to do, how the outcomes are, and how the entire future of medicine is going to be.
Thank you. See, when we go to consulting physicians, we give them extra time. We rather need extra time, right? So maybe give them a minute extra.
Okay,
So Dr.
I'll
Madhu.
make this quick. So to me, I think the biggest challenge for healthcare is sustainability. And it's a global challenge. It's a challenge in the US, it's a challenge in the Middle East, it'll be a challenge in India. And I think especially with device companies, you know, robotics, medical devices, they've really made care better, but we have only measured effectiveness, we have only measured outcomes, we have not measured value. And I think value, which is, you know, are we saving readmissions, cost of care? I think with medical devices, we have to pivot from just measuring only effectiveness to actually measuring value, because this is going to be important for patients, it's important for providers, it'll be important to the government, all of us. So I think sustainability is where we need to pivot and focus on.
No, thank you so much, Dr. Madhu. So I think just to summarize, as we just talked about it, there's a very clear need for effective healthcare in India. That's why, in fact, all of us are in this hall. We also all do realize that we can't do it individually. There's a lot of collaborative spirit that is required. And some common themes there are coming out to be leveraging data, patient-centric innovation, and really measuring outcomes for the partnerships to be sustainable and scalable. My last point would be, I know these three gentlemen from my career. They're brilliant human beings, brilliant professionals. If you can catch them during the next networking break, please leverage that, because they can really give you a lot of information that would be much more of value for the whole day that you have spent here. So thank you so much to the audience, but thank you so much, the three of you. It has been a pleasure.
Thank you. Thank you, Mandeep.
Yeah.